Some patients who went to the dentist recently now have to worry about whether they were exposed to HIV and hepatitis.
Okay, in 2026, one would not think that in the United States, this should still be happening. But these are serious accusations and serious illnesses. So let me just give you a little bit more perspective before I continue. If you have been going to this clinic, first, don't panic. We will go over what you can do now, what are your risks, and what are your options if you've been exposed. This video is not just for people who've been exposed to this dental clinic, because we can encounter these germs in everyday life. Exposure is not the same as infection, but the point of this video is to empower you, not to make you scared. By the way, my name is Dr. Liu, and I'm a double board certified infectious disease and internal medicine physician. I've been in practice for nearly 3 decades. So I've seen lots of hepatitis C, hepatitis B, HIV, all different types of hepatitis. And I've been around long enough to know that we have made tremendous medical progress in the treatment of hepatitis C and HIV and in the prevention of hepatitis B. And to give you more perspective, there's actually millions of people who acquire these germs from people they interact with on a day-to-day basis, not healthcare workers. But in the United States, roughly 37% of new hepatitis cases in older adults are suspected to happen from unsafe medical procedures. And as a healthcare worker, I put myself at a high risk of exposure to a variety of viral, bacterial, fungal, infectious diseases. Hence, there are things that you can do to prevent exposure, as well there are things that you can do to mitigate infections after you've been exposed. Now, to be clear, I don't know any of the parties involved in the case. I don't know the dentist or the staff or the lawyers or the state attorney that is suspending her license and her ability to practice. I'm not going to comment on the doctor at all. I don't know her. I have no idea what her practice is like. All I know is I heard on the news that the Pennsylvania State Department was first informed because someone complained. And then the state contacted the local authorities who then went to observe the clinic.
They had received a complaint about this dentist and conducted an investigation. Our team went out with them to conduct an on-site visit to document the practices at the dentist office.
The ensuing inspection order goes into full detail about the findings. Those orders state that Dr. Chopra occasionally set aside used single-use anesthetic vials for reuse.
So let's flag that. So she reused single-use anesthetic vials. Now, we'll table that.
And that she does not replace saline bags used for implant procedures until the bags are empty.
Okay, so she doesn't replace saline bags used for implant procedures until the bags are empty. All right, that's a second violation.
It ends up being a lot of possibility of transfer of bodily fluid between patients.
What I want to do in this video is to put some perspective on what's going on so that we're not panicking. This video is just my medical opinion. I don't work for the public health, but I do want to go over what exactly places these patients at risk from the accusation list. And second, I'd like to go over whether or not these risks are considered high or low. And third, let's talk about these chronic viral conditions or even acute viral conditions that people could be at risk for that maybe it's not on the list. And then fourth, how you can prevent from this happening to you, both as a patient and as a provider. And of course, I don't want to forget that to remind everybody that, we do have different kinds of treatment that can help people. So if you think you've been exposed, make sure that you contact a medical professional, an MD or a DO, basically a medical doctor, for these exposures, regardless if you've seen a dentist or not. And lastly, let's discuss who you can see to really support you right now, because you don't want to just go to a random person who gives you the wrong information, right? I'm an infectious disease specialist. So if you think you've been exposed to something very severe, when you can, go see an infectious disease specialist.
And Rick, health officials are contacting patients from Smiles at Rittenhouse Square who went to the clinic between April of last year until the present day.
Okay, so that's April of 2025 till today, which is May, I think today is May 25th of this recording. 2026.
The reason is what health officials are describing as possible exposure to serious illnesses and viruses, including, as you mentioned, HIV. The investigation is ongoing, but Dr. Kirti Chopra's license to practice dentistry has already been suspended temporarily, and her practice, Smiles at Rittenhouse Square, has been shut down. And it all started after the state health department contacted the Philadelphia Department of Public Health.
So let's think of how reusing single-use vials could do that, or reusing saline bags can do that in a sec.
Health officials say even though the risk of exposure is low, Dr. Chopra's patients are being encouraged to test for exposure to hepatitis C, hepatitis B, and HIV.
Okay, so hepatitis B, hepatitis C, and HIV. Now, of course, there's other bacteria, fungi, and viruses that potentially can be transmitted, but these are the three that poses long-term consequences. The other ones, probably if they've been exposed, would have had shown symptoms. So these germs, most of these you get through basically lifestyle issues, which we will get to later. But again, once you get exposed, there are things that we can do to support you. And now I'm happy to tell you that hepatitis C is curable. It wasn't when I first started practicing as a young physician. And now HIV, the treatment options have exploded. Those are the good news. The bad news is that hepatitis B and HIV, they can still be chronic diseases that can last a lifetime. All three of these diseases can cause acute and chronic symptoms. They can all lead to various cancers, other infections, other non-infectious complications.
An attorney representing the practice sent Action News a statement reading in part, quote, Dr. Chopra will continue working cooperatively with public health officials regarding patient notification, testing recommendations, and any required infection control remediation.
Okay, so they will notify all their patients, and the office is supposed to let the patients know what tests that they recommend. And then the office itself has to probably improve their practices of sterilization.
We spoke with people who live in this part of Center City who say this is not something you'd expect when going to the dentist.
No, it's not something anybody expects going anywhere when they're having a medical procedure. Now, to be fair, it's not just dental procedures that puts people at high risk, any kind of medical procedures, any kind of cosmetic procedures, any kind of manicure, pedicure, facials, even haircuts, razors, shave like I guess barbershops. So anytime you have friction on the skin, or you pierce the skin, or you cut the skin, or whether we're talking about the skin on the outside, like your face or on your hands or on your feet, or inside your mouth, is a risk of transmitting an infection. But of course, that when we are board certified by the state that we practice in, the state expects us to have gone through training on sterilization or good practices. Let me find the exact report on what happened, because they don't actually describe all the, probably in detail, what exactly happened. I'm going to search for exactly what happened because I think that's important. Okay, here it is. I found it. Number 13, respondent admitted to Commonwealth investigator that she occasionally sets aside used septicane vials for reuse with other patients, okay? So she's reusing an anesthetic called septicane. Okay, so number 14 are single-use items. So the risks of reuse upon subsequent patients include, but not limited to, transmission of hepatitis C, hepatitis B, human immunodeficiency virus, as well as other pathogen transmissions, okay? So that's number 14, that's why. So number 1 is reuse of vials, okay? So let's keep that in mind. And let's see how reuse of vials can transmit an infectious disease. Okay, so let's pretend that I'm going to draw some of this under aseptic technique, right? So I'm gonna put some gloves on, okay? And this is my syringe. It's supposed to be brand new this is a pretty old syringe that I'm reusing so I don't have to waste good stuff, as demo only. I don't use these in people, okay? But So I'm going to pretend that this is a needle. YouTube has a issue with people showing sharp objects, so I'm going to spare the needle, all right? So when a practitioner opens up a vial, now I've never used a septocane vial. I don't know what they look like, but I assume it's like a lot of anesthetics that you just kind of pop it off. It's a pop-off tab, okay? So that the physician or practitioner will pop off the tab. And what they could do is, before they pop up the tab, they can wipe it, right? They can, in fact, wipe the whole bottle so that it makes sure that when they handle it, it's sterile from alcohol, okay, to decrease some of the germs. And then when they pop off the tab, to wipe it again, just in case they touched it, all right? So then you wipe it, and then you're going to open your syringe, and then you're going to stab it, draw out whatever you want to draw out, okay? And then you're going to use it in your patients, right? So that's generally what happens. So it doesn't really matter the size of the vial. If it's labeled single use, it's because the vial doesn't have a preservative, and bacteria can grow in it, fungi can grow in it, that is in the air, on the practitioner's fingers, or around where that patient's area is. So let's say if this is a patient's field and I have other things that are maybe not sterile that I'm putting here, right? And then I put the vial. This vial, as soon as I put it down, is contaminated with the patient's microbe. And since this is a dental office, I assume it's going to be the oral microbiome as well as the skin microbiome, okay? The nasal microbiome, right? So that's the thing, is once it lands on a patient field, it is dirty, okay? So if you're going to reuse a vial, first of all, because there are vials that can be reused multiple times, preferably though, people only want one vial used per patient, right? But in practice, that's not what happens for a multiple use vial. So theoretically, let's say if this was in the patient's field, if this was a field that is not related to like a common area, a clean surface, a clean field, didn't have any used equipment, it's totally a sterile area, and this is a multi-use vial. If this syringe was brand new, every time I touch this with, of course, cleaning it with alcohol, right? Like a clean alcohol swab, I could potentially do this and keep this bottle sterile. And the only reason why that this can be reused multiple times is because it has preservatives in it, such as EDTA, that can prevent bacteria and fungus to grow. It doesn't prevent viruses to grow. So none of these preservatives prevent any kind of virus from growing. Okay, so if you get this contaminated. Now let me show you how easily things can be cross-contaminated. I'm going to move my computer right now because I don't want to get it all messed up. Okay. So I have here some cornstarch. Let's say that I just worked on my patients, like literally I just touched the skin. I'm going to get the cornstarch is their microbioflora, okay, microbiome on their skin. Or you can imagine if the dentist just worked in your teeth, okay? So let's say I did that, okay, I'm just working on their teeth. So my gloves are now contaminated, right? And so let's say now I'm going to go get some multi-use vials, okay? So first, if I don't change my gloves, I'm going to grab onto this, right? And I'm going to grab onto my syringe and look what's happening, right? I'm not even doing anything yet, and the germs are just spilling on the lid, okay? So this is what happens if you don't wash your hands. This is what happens if you don't change your gloves. And this is what happens when you don't have a clean field. Like this whole thing is like full of germs, right? It's just spraying everywhere. And that is how easily germs can spread. And it's even easier than that. Okay, so let's say these white particles represent hepatitis B, and literally it's on your table. So let's say I take my gloves off and I'm just talking and I put my hands here and I have a cut in my hand. So what did I just do? I just basically exposed my cut hand to hepatitis B viruses that can survive outside in the environment for an entire week, 7 days. It is that contagious, folks. So if you have, an open wound, I should say, on your fingers, on your mouth, anywhere, and you get exposed to these germs, especially hepatitis B, you could potentially get it and get infected by it. It is that easy, okay? But it does require an open wound, body fluid and blood exchange of some sort, right? So you're not going to get hepatitis B or HIV or hepatitis C from just shaking someone's hand if your skin is intact, you don't have any broken skin. But you could get it if you're touching someone's broken skin, if you're doing CPR, if you clean up someone's like emesis, like vomit, or if their urine or, their poop, that kind of thing, right? Or, private part fluids that people transmit when they're having fun, okay? So all those different ways you can get hepatitis viruses, HIV, you can get certain parasites and lots of other infectious diseases, right? So this is why the public health wants to make sure that, people don't have it. So if you get hepatitis, would you have any symptoms? Maybe, maybe not. And that goes true for HIV. So let's talk about these three viruses separately. And first of all, I want to say if you're an adult and you've never had an HIV test, you got to go get an HIV test, as well as a hepatitis C test, as well as a hepatitis B test, okay? Now, just because you're vaccinated, like in the past, that's only for hepatitis B, doesn't mean it's still protective. So that if you've been exposed, you need to go and get that evaluated. And they evaluate this by several markers. There's the hepatitis B surface antibody marker, there's a hepatitis B core antibody marker, and there's a hepatitis B surface antigen marker. So if you're hepatitis B surface antibody positive and your core antibody negative, then you've basically gotten hepatitis B antibodies, but you've never had the infection. That's probably you have the antibodies from having had a vaccine for hepatitis B, okay? That is like the most effective way to prevent hepatitis B because we don't have good treatment options for hepatitis B. There's no cure for hepatitis B. Hepatitis B can cause liver cancer, can cause cirrhosis. Acutely, it can cause fulminant liver failure. You can be jaundice. You can have yellow skin. You can throw up, just feel miserable and lousy. Your liver functions may be through the roof and everything just may not work well. You have fevers, right? And this could happen for hepatitis C too, could happen for HIV. For HIV, like all these viruses, you could have potentially a non-specific cold, or you can have a fulminant reaction. It just depends. So if you get a cold and a rash, that warrants an HIV test at the minimum, okay? If you've had recent exposure. So exposure is usually, again, blood and body fluid exposure. You don't just get it from shaking someone's hand. You generally get it from exchange of blood or body fluid. Now, potentially you can get these things from saliva. It's harder, but if you have a cut in your mouth, right? And especially because hepatitis B is very infectious. And if someone else has a cut, maybe they have a cut because they have gingivitis or they just flossed, right? Or they just brushed your teeth. That's a great way to transmit viruses, okay? So that's why these things are very contagious, and you should make sure that if you're wondering at all, go get it tested. It's very easy. It's a simple blood test, just like getting a CBC count or a Chem7 count, right? So when you are exposed to these viruses, they change your immune system, okay? You become immunosuppressed so that you then get more susceptible to getting other viruses, potential other infectious diseases as well. This is why we want to prevent these three viruses specifically, because they change people's immune system. And these viruses, even though we do have a cure for hepatitis C, we don't have a cure for HIV. You have to be on lifelong therapy and sometimes multiple drugs potentially. And there's all like these little nuances about resistance and things of that sort, but that we're getting ahead of ourselves. The most important thing is for you to understand that it's really important that when you go to a clinic, that you see your physicians putting on new gloves. They're handling drugs separate from like the patient table, right? Unless it's a single-use vial. If it's a single-use vial, they should be opening that vial in front of you. They should be opening the syringe in front of you, okay? And you should be looking at them, make sure that they're washing their hands. That it's not just, they're just coming in from the outside, that they preferably use soap and water, but lots of people use hand sanitizer. They need to just wash their hands, okay? Whenever they enter the room, they should be washing their hands. Now, before I continue, I'm just going to clean this up because it's going to get all over my clothes eventually, right? I'm trying for it not to get me dirty. So I'll be right back. So now let's just go back and look at the CDC document and look at the safety steps. So before the procedure, it says that in a single dose vial, if they've already been assessed with a needle, if they've already been punctured with a needle, that you shouldn't reuse it again. You should throw it away, right? Now, in multiple dose vial, it's important if you've used aseptic technique to aspirate the drug, it's important to check the expiration date. Make sure you're not using expired drugs. And then you have to visibly inspect it to make sure that it doesn't look odd. It's not cloudy. It looks like the original unopened bottle, right? You don't want it to be discolored, right? Something weird in it. You want to make sure you throw that away. And when in doubt, throw it away. Now, then during the procedure, it's important that the provider makes sure that aseptic technique is always used, right? Whenever you're getting the drug. So if the provider needs it in the middle procedure, somebody else has to go get the drug if the provider's hands are dirty. And of course, you have to use a fresh needle and syringe for every injection. And needles and syringes should not be used after the patient, right? We need to throw that away. And before you handle any of these reused bottles, right, it's really important to scrub the diaphragm with alcohol. And then all these things, these medication extractions should be in a specific medication prep area, aside away from the patient. And bacteria grows very easily. And it also depends on what else is in the sample. For example, lipid-based anesthetics like propofol, their ingredients has soybean oil and egg lecithin. That actually can grow a number of organisms, including staph, as well as gram-negative rods, including Pseudomonas and E. coli. It's basically like a petri dish of food. Other environmental spores, like spores in the air, they can land, they hatch, and they can grow. So there's bacterial spores in the environment as well. Bacillus species is one of them. So if someone's eating rice and there's rice spores around the office, right? I mean, I don't know what kind of surface it is, then potentially those spores can get in there and grow. But some drugs like lidocaine, pivivacaine, they actually have inherent antimicrobial properties. Eugenol are inherently antimicrobial, so they're more resilient, right? So it really depends on the drug and what else is in that drug, right? But we're always worried about gram negatives like E. coli, Pseudomonas, and that's, why people use preservatives to inhibit bacterial growth. Now, I found a paper of microbial contamination in the Middle East in single-use vials, but you can't really extrapolate that to the United States because the practices, sterilization techniques, the equipment, all that stuff is not the same. I have been to foreign countries looking at their clinics, and it is absolutely not the same as the US, okay? So just because this is happening around the world doesn't mean that it applies to people who live in the United States or who practice in the United States. But it just illustrates that this is a common problem all over the world. So that's why all of us need to really be very cautious about using aseptic technique when we put our gowns and gloves on when appropriate and when we work in a sterile field. And of course, the CDC reminds everybody that these needles and syringes should not be reused. Single-use vials should not be reused. Throw those away after the procedure. So how do you contaminate it? It could be on a dirty field. And this way, it's contaminated because it's touching or surrounding other stuff that belongs to the patient that's dirty. And technically speaking, if your glove is dirty, if your hands are dirty, if you touch the top of the diaphragm and then you don't clean it with alcohol, And even if you use a fresh needle, if you don't clean it, you can be pushing bacteria into the container. And on the paper, CDC literally warns that infections can be very costly, not only to the provider's practice, but also to the patient and the patient's life. And it warns providers that if you misuse medications, either single dose or multiple dose, then you can put your practice and your patient at risk. So let's not do that, folks. Let's practice good recommendations. The point is that germs are everywhere. Some are more deadly than others. Generally, if you get a bacterial infection, it's not going to show up a year later. Around a procedure, it's going to show up days to weeks later. Okay, it really depends on the infected organism. Of course, at any time, if you have an open wound, you can get infected. It doesn't need to be at surgery. Just having that wound leaves you more susceptible to infection as well. And by the way, if you find value in my videos, would you mind checking if you're subscribed? And if you are not subscribed, please hit the subscribe button, like button, and share button, because it does change how many people get to watch my videos. I appreciate your partnership in helping to change the world. All right, let's keep on reading. Respondent does not replace saline bags used for implant procedures until the bags are empty. Okay, so that means that one bag of saline, now I don't have any saline bags to show you, but that's used for multiple people, which is a problem because I don't know how long that saline bag is up there for. And every time I don't know if they're taking the needle out or like the adapter out and putting it out. I'm not quite sure how they're doing that. So the next one is bags of saline solution are single-use items. Exactly. And risks of reuse upon subsequent occupations include but not limited to transmission of hepatitis C, hepatitis B, HIV, and other pathogens. Yes, because the saline can grow things in it. That's number one. Number two, if you're handling that, I just showed you, if you're handling other people's stuff and you put it on and then you're manipulating that area, you're basically, whatever germ is around that area can potentially go back in and be transmitted to other people, right? So that's why we don't want to use single-use items. Okay. Respondent and her staff conduct unwrap, flash sterilization of critical and semi-critical dental instruments. Okay, so she basically sterilizes instrument, and then packages that, it seems. Upon completion of the unwrap, flash sterilization, respondent and or respondent staff utilize non-sterile glove hands to place the unwrapped sterilized instruments in unsterile sterilization bags. Let me read that over. Upon completion of the unwrap flash sterilization, okay, so the instruments are sterilized, and then the respondents and our respondent staff, they utilize non-sterile glove hands to place the unwrapped sterilized instruments in unsterile sterilization bags. Let me go get some utensils and I'll show you how that works. So they have an autoclave and they just sterilize their instruments. Now, I'm just going to pretend that these are dental instruments that were just sterilized. So if I touch it in any way with my hands that are not sterile, my hands are not sterile. So even if I wash my hands, even if I scrub my hands, even if I use surgical scrub to scrub my hands, HEPA cleanse to scrub my hands, they're never going to be sterile. So if I want my hands to be sterile, I need to open up sterile gloves, okay? And unless I open up sterile gloves, my hands are not sterile. This box of gloves is not sterile, okay? So if I am a surgeon performing surgical procedure, I would be wearing a mask if I'm in a sterile room. And if I, am wrapping up autoclave equipment, I definitely wouldn't be talking like this because I'd be spitting on all this equipment. But I would be wearing a mask. I would have to be wearing sterile hands, okay? So let's say I take it out. This is sterile, and they're putting into like an unsterile bag. So unless I've sterilized this bag or this bag comes out from a package sterile, this is a Ziploc bag. It's not sterile. It's clean, but it's not sterile. I'm not going to put any kind of, surgical instrument in here because these bags aren't sterile, okay? But, they're clean, but they're not sterile. So you have to buy sterile bags. It has to be sterilized and it has to be guaranteed it's sterilized. So I'm going to put these bags in here with my hands. I'm going to show you how I wash my hands with soap, okay? But even though I wash my hands with soap, there's always going to be germs on it. And I'm going to just put a little cornstarch on this, okay? This is my cornstarch hand. It's just a demonstration. Even though I'm washing my hands, never going to be 100%, remember. So now I'm going to touch this, right? And I'm going to put it in the bag. And then I'm going to touch this, and I'm going to put in the bag. And I'm going to touch this, pretend you didn't see that fall out. I'm going to put in the bag, okay? So now I have an unsterile hand, right? Because I didn't use sterile gloves to handle sterile equipment. And if you look closely, you'll notice that there's white all over this supposedly sterile surgical equipment, right? I guess this didn't stay as well, but there are white flecks, okay? And then definitely you can see this handlebar is white. So if you don't have sterile gloves on, folks, your hands are not sterile. Your hands may be clean if you wash it with soap and water, if you wash it with surgical scrub, if you scrub it with surgical scrub, if you scrub it with HEPA cleanse, you can scrub till you're bleeding, right? And of course, if you're bleeding, you're definitely not sterile. But no matter how well you think you've cleaned your hands, they're not sterile unless you cover them up with sterile gloves. And sterile gloves don't come in a box. They come in individual packages, okay? And if you're going to autoclave and talk in front of whatever you just cleaned, you're spitting. I'm literally spitting on this, even though I don't see the spit. But that's kind of, your spit can project 5 feet, depending on how aggressive you speak, okay? So the point is that that's what they're accusing this office of doing, is having the dentist and the staff not treat sterile instruments properly, which is a huge problem. And I find this to be more of a problem than reusing the single, vials, even though the single vials can potentially transmit viruses. But the reason is because contact surface is so much greater. These instruments are going to go deep and repetitively and be surrounded by blood, depending on what these instruments are used for, right? They're dental procedures, implants. So you're going to go deep. You're going to go to the bone. If you infect the bone, that's a huge problem. That's called osteomyelitis. And then that is potentially more surgery, long-term antibiotics for at least 6 weeks or longer. And it's just, I have seen people get their mandible removed, not necessarily from a botched surgical procedure, but just because they got an infection. Most commonly, I see it from complications of a lack of dental care for people who let cracked teeth go too long, loose teeth go too long, for people who have gingivitis, who don't get routine cleaning, for people who have cavities and then get root canals, they get abscesses, right? I've seen all these things from just common, everyday, the lack of care of your teeth. I understand that this is a big deal, right? Not keeping sterile instruments sterile, but I also want to just kind of give you guys a little perspective. Most of the time, the complications that I see from dental problems is that the dental problems have gone too long. And I'm not a dentist. I just see the bad complications, right? So I still see the cracked tooth and all that stuff, the minor stuff, but they're usually outpatient treatment. By the time I see it, the face is swollen, the bone is involved, the sinus is eroded. I've seen it go through the cheek, like the infection literally drilling a hole through the tooth to the cheek, where then there's pus coming out of the cheek. These are the cases that I see. So therefore, go make sure you see a dentist, get your tooth cleaned, and just ask them, are you guys using sterile gloves? And do you wear masks when you deal with the autoclave? And how you store your instruments, the bags, are they sterile? How do you sterilize that? Or do you buy them already sterile? Usually, I would assume they would buy sterile bags, right? We can't just do clean. We should do sterile, right? In the dental industry, I'm sure the dental board has their good practice hygiene and good practice recommendations, right? Because lots of people get great dental care and they don't get complications of getting infections and things like that when they find a good dentist, okay? Let me clean this up again because I'm going to get myself dirty with cornstarch. Be right back. Okay, respondent and a respondent staff package and unwrap flash sterilized instruments on contaminated reprocessing areas. So basically they were working with sterile instruments on a dirty field, okay? In general, that I would think that would be an easy thing to get, right? Go get yourself a clean area and line it up. Make it a sterile field, right? Before you work on it. The sterilization bags are then stored within the office for use upon a future patient. Okay, so I guess they're not using the bags. I'm not quite sure what kind of bags they are, but they're reusing it. None of the instruments previously placed in the autoclave and found at the respondent's office were sterile. Okay, so that means all her instruments are contaminated, including critical and semi-critical instruments, as the instruments had been handled with potentially contaminated gloves and packaged into potentially contaminated peel pouches after the autoclave cycle. Okay, so I kind of just demonstrated that whole thing. Critical and semi-critical instruments which are not sterile or unsafe for patient use. Okay, I think we all understand that now. Dental handpieces and their components were observed to remain attached to the dental unit line in the operatory following patient treatment. Okay, so you know how the dentist puts like tools, drill tools and stuff? Apparently they are probably left there after the patients left. I mean, those drill tools need to be changed per patient. They shouldn't be, remain attached if another patient comes in, right? Dental handpieces come into contact with blood, saliva, and other tissues must be sterilized between each patient. I would 100% agree with that. I think we all kind of understand that, right? Those drill units need to be sterilized if you're going to reuse it. Respondents' actions described above place patients at risk for transmission of hepatitis C, B, HIV, as well as outbreaks of viral, bacterial, and fungal infections. I absolutely agree with that. Based upon the foregoing factual allegations, respondents continue practice as a dentist within the Commonwealth of Pennsylvania, along with the exercise of any other authorizations to practice, blah, blah, blah. Okay, so took her license to practice away. Okay, what happened here really can happen at any clinical or dental practice around anywhere in the United States as well as overseas, right? For example, last year in England, 25 people got botulism from Botox injections. So Botox is a paralytic toxin that the medical and cosmetic industry uses to paralyze nerves. So when you paralyze a nerve, then you basically can get rid of wrinkles, or you can get rid of the muscle's ability to contract. Sometimes the nerve repetitively fires so that it stays in contraction. Or if you ever had your muscles stay contracted, you know what that means. That's a muscle spasm. That is very uncomfortable and painful. Sometimes it can cause migraines. It can cause excessive sweating. And one treatment is to paralyze that nerve. And that can even treat some people with overactive bladders or even a lazy eye. So a trained medical physician, if injected right, can actually temporarily paralyze that muscle. So obviously, this is a high-risk procedure. It's a high-risk toxin that I personally would never do as an elective cosmetic procedure because I don't think the complications are worth the cosmetic effects. But there are lots of these cosmetic clinics that are popping up that really are unlicensed. And what they're doing is they're buying unlicensed products online. For what reason? To save money. So if you're going to buy something online, it could be mislabeled, and that's what happened. So they were giving people more toxin than what was on the label. So as your practitioner, where did you get your product from? And go to like an MD or, a licensed physician to do these procedures. You're going to do it like a plastic surgeon or a dermatologist. Because if you're buying from an online pharmacy, of course, then it may not be as reliable if you don't get it from a reputable source, right? There's a lot of unreputable online pharmacies. And the cheaper, you buy things, the more risk that you're taking. But just to be clear, it's not just injections at beauty salons that put you at risk. You can have tools that manipulate your nails and your feet, a manicure, pedicure, makeup, The makeup itself can spread viruses and fungal infections and bacterial infections, because especially cosmetics that are water-based, that are reused with reuse tools that aren't adequately decontaminated, can cause problems. So that's another reason why I don't, go to manicures or pedicures. I just find those areas to be too high risk for me, especially if, I don't get my own tools. So if you're going to go consistently to a barber or get a manicure, pedicure, consider bringing your own stuff, your clippers, your scissors, your razors, right? Nail care tools, anything that penetrates your skin can be a huge problem and spread not only bacteria, but viruses, hepatitis, and HIV. And of course, there are other infections that are not as common that you may not hear about, but clinics that shut down all the time because we find unusual clusters of infections. For example, non-tuberculosis mycobacteria infections. That happened in Florida in 2023. This is the result of a good public health system that then catches and watches by observation what's going on in the environment, and then they do something about it. They investigate, and then they may shut things down, right? That's why we all need to support an effective, strong public health system so that we can contain and mitigate these exposures. You can get infected from, let's say, piercing your ears, right? Or piercing your mouth or your nose. There are some places you just shouldn't pierce, right? Anything with a cartilage. So if you pierce your ears and then you pierce your cartilage, you can get that infected and it'll never come back. I've seen people lose their ears because there's no blood supply in cartilage, folks, right? And of all these viruses, HIV, hepatitis B, hepatitis C, do you know which one is the most contagious? Hepatitis B. You can spread it microscopically through blood and body fluids, okay? It can survive for 7 days on the environmental surfaces outside of the body. So yeah, that means you can get it at work, when you hang out with your friends, and at school. But obviously, certain behaviors will increase your risk. Definitely if you get surgery from contaminated instruments, you'll be at higher risk. But lots of people immigrate here to the United States. And if you're an immigrant, you need to get your hepatitis B status checked. If you grew up here, most likely you've gotten your hepatitis B vaccination. If you've never received medication to help your body learn to prevent hepatitis B, that's the whole point of good vaccine. But hepatitis B is pretty good for many people if you respond to it. So that's why you need to go get your hepatitis B status checked, because sometimes you may respond and then you don't respond. If you have a compromised liver, make sure you get your hepatitis B status checked. And you shouldn't just get one check and you think you're good for life. You have to repeat your hepatitis B test if you don't have protected antibodies whenever you think you're exposed. The only protective antibody is a hepatitis B surface antibody. If you don't have that antibody, you're not protected. If you're a healthcare worker and deal with any blood or body fluid, make sure to get your hepatitis B status periodically checked just to make sure that you don't have active hepatitis B. Now, if your partner has hepatitis B, then you do need more frequent checks. If you're pregnant, regardless if you think you've been exposed or not, you should go get that checked, because if you turn out to be positive and have an active infection or an uncontrolled infection, even if it's chronic, then that will put your infant at higher risk unless your doctor takes specific precautions at birth to mitigate that risk. So if you are pregnant and you have hepatitis B, the baby can get specific hepatitis B antibodies. That means pre-made antibodies against hepatitis B to protect infant after birth. If it doesn't receive these protective antibodies, then they are very high risk of acquiring chronic hepatitis B, so acute hepatitis B, that will then be chronic hepatitis B, and this will last a lifetime, and they have a higher rate of progressing to cirrhosis and liver cancer. This is very prevalent in Asia, where the moms are infected and give it to their babies. Now, the thing with hepatitis B is that 1 out of every 2 people who are infected, they actually don't know they're infected. So if you aren't already infected, the good news is we actually have medication that can help stimulate your immune system to recognize hepatitis B, so that if you ever get exposed, if you get this medication to train your antibodies, then it can protect you from getting hepatitis B potentially. Now, you have to sleep well the day before you get these medications, because if you don't sleep well, then your immune system is suppressed and it won't be able to mount an appropriate antibody response. And of course, if you're interested in finding out about these medications, talk to your doctor, because that is the best way to prevent hepatitis B. Once you get hepatitis B, your immune system may or may not be strong enough to get rid of it. It's a DNA virus. It actually integrates into your own genome. Now, if you have joint pain, fevers, clay color stools, or dark urine or nausea, throwing up, like I said, your skin turning yellow or be jaundice, you need to go see a medical doctor. Those are signs that your liver is failing. Now, currently, just about half the cases of acute hepatitis B, they happen to people in between the ages of 40 and 59. The states with the highest cases are in the Appalachian regions. And what's even more devastating is that hepatitis B can lead to lifelong chronic hepatitis. That means we don't have a cure for it. We actually don't even have good treatment for it. And this can cause liver damage and elevate your risk of liver cancer. So that's why prevention is a way to go for hepatitis B. Now, when it comes to hepatitis C, I would say the majority of people, they don't know they have it. So anybody who's received any blood products, if you, specifically, I would say blood clotting factors at that time. If you have anything to do with you reusing needles at all, so like if you've ever reused needles, ever done any illicit drugs, that's how you get hepatitis C, right? So it is recommended that every single adult get screened for hepatitis C. We have actually cures for hepatitis C now. You need to get your genotype. You can see literally your primary care doctor, primary care doctors, infectious disease doctors, and gastroenterologists. They can all treat hepatitis C. So, and we have good regimens. The regimen courses are so much more tolerable than when I was treating hepatitis C early in my career. It was actually pretty bad. People would get very, very sick, but it didn't really work, right? That's kind of the irony of it. Like you had to treat them until they felt bad, because that's what happened to all the treatments. It was interferon and ribavirin. It was really, really bad therapy, and it just didn't work. And all people on the treatment felt miserable. And so thank goodness that we have effective drugs now where people actually tolerate very well. Now, the thing is, for HIV, that's also a virus mostly transmitted through intercourse. So all three can be transmitted through intercourse, but HIV particularly. So if you've ever had any high-risk activity, you should be screened, whether you're an adult or not, okay? And the sooner we can get you on the right treatment, the better your prognosis. And so that's why we want to screen everybody. It's not so easy as screen and just take a drug. It's screen, and then we have to do more tests to kind of figure out what kind of virus you have, and that's how they pick the appropriate treatment regimen. So we do have very good treatment. People live for decades. Before, when I, was a young physician, I saw a lot of people who didn't survive HIV. They get devastating complications. The body becomes like a petri dish, and they start getting tons of other infectious diseases that normal people don't get. So it's not really the HIV that gets you. It's HIV suppresses your immune system, and then you're susceptible to a ton of different infectious disease and cancers. Those are the things that then get you, right? And so this is why we want to treat HIV. We want the people to actually have a robust immune system, so that we now have drugs that can suppress HIV to help your body be able to keep its immunity, right? Because the virus attacks your CD4 cells, like the generals of your white blood cells. And when they get knocked out, like everybody else kind of goes dumb. And then the body just doesn't work right when you don't have an adequate immune system. That's why immunity is number one, folks. Be good to your immune system. Don't give it stressors that it doesn't need to get, right? And that means take care of your teeth, go see the dentist, and eat optimally to help your immune system be as strong as it could be every day. So let's give you a little bit of background of why the public health is having such an aggressive reaction to these practices. So this country has had actually a number of egregious incidences involving breach of good practice. Not just with reusing medication that's not supposed to be reused, but reusing contaminated needle, reusing saline bags and infusion lines, and even having people abuse narcotics themselves, having providers being infected with infectious diseases. So I found here, look at that. If I scroll down, it will show you a bunch of cases that happened from New York to Texas to Florida to Nevada, West Virginia, Pennsylvania, Mississippi. I mean, every single state probably has had people who are not following good practices when they are handling reusable or sometimes not reusable material and practicing procedures. So in this 10-year period, there's about over 130,000 people exposed to possible a transmission of infectious disease because proper procedures were not followed. And unfortunately, one case resulted in over 40 hepatitis C infections. So if you've been exposed, go see a physician. Just see a primary care physician because you just need a general screening. If you've been exposed acutely, then you should see an infectious disease physician. First, you go to your own human resources, right? And then you let them know if this was an on-the-job exposure. If not, then go see your primary care physician or go to one of those free clinics. There's a lot of STD-free clinics that you can go to one of those in your area or an urgent care or an emergency room. If you've been exposed acutely, it's really important you get help the same day. This is not something that you should sleep on and wait the next day because potentially we may be able to give you something that can help prevent chronic infections, right? Wouldn't that be nice? So that's number one. That's called post-exposure prophylaxis. And we do have that available for HIV and potentially that could be available for a hepatitis B. Make sure that you see someone ASAP. Do not wait at home. The bottom line is that when you get a virus, they change your immune system. And if you want to make your immune system more resilient, it's important that you optimize your lifestyle as well as the foods that you eat. And so this is why I do this channel. If you want to learn exactly how to do that, watch the next video.